Hey everyone, I am so pumped you're here. Think of me as your ultimate study buddy today because we are going to completely conquer medical terminology in this explainer. I know, medical words can look incredibly intimidating, like a totally foreign language, right? But they're actually just built from simple, repeatable puzzle pieces. Once you know the pieces, you totally own the board. So, you ready to decode the language of medicine? We're about to go on a hyper-fast, highly precise tour of medical word parts. We're going to lock in these meanings so fast you'll honestly feel like you've unlocked a superpower. Let's power up and jump right in. Okay, let's dive into our first prefix, a. In medical terminology, a simply means pertaining to no or without. This brilliantly illustrates our first term, apneic. When you hear apneic, it literally means pertaining to no breathing. If the lungs just aren't pulling in air, the patient is in an apneic state. See? One simple letter at the start of a word gives you massive clinical meaning. Building right on that, we've got the prefix anti. Now, you probably use this in everyday life all the time, and it means the exact same thing in medicine, against. So the crucial point here is that when we look at the term antibacterial, it literally means pertaining to against bacteria. It's your medical defense line, actively fighting off those little microbes. Now here's a really interesting prefix you absolutely need to commit to memory. Dis. Dis signifies something that is difficult. Take our strict example here, dysmenorrhea. If you break that down, the dis clearly flags that this is a condition of difficult menstruation. Whenever you hear dis at the start of a word, boom, you immediately know the patient is experiencing some level of difficulty or pain. Moving right along, let's check out endo. This prefix means inside or within. So what happens when we attach it to a clinical procedure? Well, look at the term endoscopy. An endoscopy is the process of visualizing inside a body part. That specialized scope is literally going endo, inside the digestive tract, to take a look around from the inside out. And sticking with our positional prefixes, we have epi, which simply means upon. This is just a perfect example of medical mapping. Take the term epigastric. Because gastro refers to the stomach, epigastric directly translates to pertaining to upon the stomach. It tells you exactly where to look, mapping right onto that specific region of the anatomy. All right, rapid fire review time. Let's cleanly lock in these essential directional and quantitative prefixes to really maximize your memorization. We've got hyper for excessive, and its direct opposite, hypo, for below. Then we have inter, meaning between, and intra, meaning within. Poly means many, much, or excessive. Post is after or behind. And finally, sub means under or below. Take a mental snapshot of these right now because they pop up absolutely everywhere. Section 1. Pathology suffixes, decoding disease. Let's get into it. Our first pathology suffix is algia. This one's super straightforward. It just means pain. It turns the word into a noun representing a painful condition. So if we take our stomach root, gastra, and add algia, we get gastroalgia, which translates directly to stomach pain. Just remember the rule, algia equals pain. Flowing right into our next suffix, look at emia. When you see emia tagged onto the end of a word, I want you to immediately think of blood. It's a noun denoting a blood condition. For instance, check out the term lipidemia. Lipid refers to fat, and emia refers to blood. You put them together, and you have a condition of fat in the blood. Simple as that. Now, what if you just want to state that a condition exists without getting into all the specifics of pain or inflammation? Well, that's where aya comes in. Aya acts as a general noun ending that simply means condition. You can see it in gastria, referring to a stomach condition, or in anemia, which references a condition of the blood. It's a fundamental building block you'll see all the time. And this brilliantly illustrates another way to describe a condition, ism. This suffix means condition or state of. Look at this really fascinating example, somnambulism. It's a complex-looking word, for sure, but with your new skills, it's actually pretty easy. It's simply the condition or state of sleepwalking. It's amazing how literal this language is when you break it down into its core parts. Okay, let's dive into literally one of the most common suffixes in all of medicine, itis. This one means inflammation. You can think of it like a fire inside the body. If we look at the term tonsillitis, it perfectly demonstrates inflammation of the tonsils. Anytime you see itis, think red, swollen, and inflamed. And hey,
Here's a quick medical word building rule for you. If your combining form ends in a vowel, like the O in arthro, but your suffix, itis, starts with an I, you drop that O. So it's arthritis, not arthritis.
Wrapping up our pathology suffixes is osis. This is a really important one because it directly indicates an abnormal condition. So the crucial takeaway here is that when we apply this to the nerves, we get the term neurosis, an abnormal condition of the nervous system. Osis is your big red flag that something in the body is in an abnormal state. Lock that one in. Section 2. Intervention suffixes, surgical actions. From diagnoses to hitting the operating room. Let's clearly contrast two very different surgical actions here. On the left, we've got ectomy, which is the process of completely removing something. For example, a gastrectomy is the total removal of the stomach. But on the right side, we have stomy, which is the process of creating a brand new opening. So a colostomy isn't removing the colon, it's making a new opening for it. Ectomy means taking it out, while stomy means making a new doorway.
Building right on that, let's look at another essential comparison. Over on the left is plasty, which means the process of surgical repair or reconstruction. If someone gets a rhinoplasty, they are having a surgical repair of the nose. Compare that reconstructive nature to the right side with tomy, which simply means the process of cutting. An osteotomy is the precise cutting of a bone. Plasty is to repair, tomy is just to cut. Also, remember our word-building rules. Because plasty starts with a consonant, if we have a word root like arthro, we keep the O to join them together, arthroplasty.
Okay, this next one packs a serious punch, tripsy. This suffix strictly means the process of surgical crushing. Really emphasize that crushing action in your mind. Look at the term lithotripsy. Litho relates to stone. So lithotripsy is the process of surgically crushing a stone, just like kidney stones being broken apart so they can pass.
Section 3. Instruments and specialties. Let's talk about the tools and the pros who use them. First up for our medical tools is graph. I want you to define graph strictly as an instrument to record. So when you look at that machine, that whole setup is an electrocardiograph. It is the physical instrument itself that's doing the recording of the heart's electrical activity. Graph always points to the hardware doing the actual recording. Let's look at another super common tool ending. Here we have meter. This one is very straightforward. It literally means an instrument to measure. And this brilliantly illustrates the concept. Just a simple clinical thermometer. The thermo part is heat, and the meter is the physical instrument perfectly measuring it. And our final instrument suffix is scope. A scope is an instrument used specifically to view. Just like we talked about an endoscopy earlier as the process of viewing, the instrument itself uses this suffix. Take the ophthalmoscope. Because ophthalm means eye, this basically locks in the definition of this tool as the instrument the doctor physically uses to view the inside of your eye.
Okay, let's tie it all together with the actual people who do the work. Let's do a quick rapid-fire run through these specialties. If a word ends in logi, like cardiology, it means the process to study that field. But if it ends in logist, like a psychologist, well, that's the person who specializes in the study of it. Then we have ist, meaning one who specializes, like a dentist. And finally, which means one who does a specific task, like an echocardiographer. So it goes process, specialist, specialist, doer.
And just like that, look what you've accomplished. You literally just mastered 30 medical word parts in record time. From the prefixes that set the stage, to the suffixes that completely define the diseases, the surgeries, the tools, and even the professionals, you have the secret code now. You are officially empowered. So the absolute coolest point to end on is this question. Now that you have this incredible foundation, what medical mysteries will you decode next? Thanks so much for learning with me in this explainer. Keep up the amazing work, stay focused, and I'll catch you next time.